So here we are at the end of the endocrine system. Are you stressed? Endocrine system stresses students sometimes. Take your time, breathe, deal with the stress. So why are we talking about stress? Well, it's impossible to remove stress from our everyday lives. Some stress, called eustress, helps us to be able to meet challenges, so it's helpful. So I'm challenging you to learn the endocrine system. Okay? Let that be helpful. You're going to use this when you get into nursing. You're going to use this later in life. Or if nothing else, you're going to use it because you have a human body, right? On the other hand, there's distress, which is harmful. Any stimulus that produces a stress response is called a stressor, and that can be almost any disturbance of the human body. Changes in temperature, too hot, too cold, environmental poisons, toxins given off by bacteria, bleeding from a wound or surgery, or even just a strong emotional response. The response to stressors can be unpleasant or pleasant. It varies from person to person, and it even varies within a person at different times based on their current situation. Your body's homeostatic mechanisms to try to counteract that stress, though, try to fix you so that it doesn't become something that's going to cause harm. So when your homeostatic mechanisms are successful, the internal environment remains within your physiological limits. But if stress is extreme, it's unusual, or extremely long-lasting, then the normal mechanisms for dealing with stress may not be enough. So the way that your body deals with stress is called the stress response, and your stress response is controlled by the hypothalamus. The stress response occurs in 3 stages: the initial fight or flight response, a slower resistance reaction, and then if the stress continues, exhaustion. So the fight or flight response, we're all familiar with that, and we know that that's nerve impulses from the hypothalamus to the sympathetic nervous system, and that, of course, also includes the adrenal medulla. And what does it do? It mobilizes you quickly to deal for something immediate, such as physical activity, by bringing large amounts of oxygen and glucose to the organs that are most active when your body is interpreting something as stressful or danger. So your brain has got to become very highly alert. Your skeletal muscles have to have oxygen and ATP to fight off the attack or flee. And the heart has to work really hard to pump out enough blood to the brain and the muscles. So during that fight or flight response, the things that are not essential, digestive, urinary, and reproductive, the blood supply shuts down to very minimum to those areas, right? So inhibit their function. This reduction in blood flow is going to cause your kidneys to release renin, and that's going to set into motion the whole renin-angiotensin-aldosterone pathway and cause you to retain sodium and retain water and elevate the blood pressure, and also to preserve water just in case there is something in this stressful situation that causes severe bleeding. So everything we just talked about there in that first response, you see here in the fight or flight response from the sympathetic nervous system. So all the things we just talked about there, they are all listed for you. My apologies, I forgot to switch the slide quickly enough. The second stage is the resistance reaction. So with the resistance reaction, the hypothalamus is going to release corticotropin releasing hormone and the growth hormone releasing hormone and the thyrotropin releasing hormone. All of these target the anterior pituitary, which then are going to release hormones. So you see here the adrenocorticotropic, the growth hormone, and the TSH. The TSH causes the thyroid gland to release more thyroid hormones, and that increases our metabolism and increases the ATP that we have available. The liver is going to release some of those insulin-like growth factors that are going to cause us to break down fats and release those components so that we can use them to make ATP, and glycogenolysis, break down that glycogen so we have more blood sugar. My computer's messing up again. And also the adrenocorticotropic hormone is going to cause the adrenal cortex to release cortisol. And the same thing that we saw when we talked about the cortisol. We break down fats. We start breaking down proteins. We break down those or start making glucose from other components such as fats and proteins. And this all, of course, is what is it doing? It's giving us more blood sugar. It's giving us the ability to make more and more and more ATP. So, okay, so my apologies. My phone went off. All these videos, I finally forgot to turn my phone off, so my apologies. Anyway, so all of these actions are increasing the amount of blood sugar and oxygen and nutrients that are available for our body to try to maintain homeostasis in these stressful situations. So the resistance stage helps the body to continue fighting a stressor for a long period of time after that initial fight or flight response has already gone away. So this is also why your heart continues to pound like crazy for several minutes, even after the stressful situation, whatever it was, has ended. So basically, it's the body's way of seeing us through the stressful episode and then slowly returning us back to normal. Sometimes, though, the resistance stage fails to combat the stressor and the body moves next into the stage of exhaustion. So the resources of the body may eventually become so depleted that you just can't sustain the resistance stage, and that's when exhaustion happens. Prolonged exposure to high levels of cortisol and other hormones involved in the resistance reaction cause wasting of muscles and suppression of the immune system, gastrointestinal tract ulcerations, failure of the pancreatic beta cells. In addition, pathological changes may occur because resistance reactions persist even after the stressor has been removed. Although the exact role of stress in disease is not known, it is pretty clear that stress can lead to particular diseases by inhibiting certain components of the immune system. Stress-related disorders include gastritis, ulcerative colitis, irritable bowel syndrome, hypertension, asthma, rheumatoid arthritis, migraines, anxiety, and depression. People under stress are at greater risk of developing chronic diseases or dying prematurely. Although some endocrine glands do shrink as we get older, their performance may or may not be compromised because of that. Production of growth hormone by the anterior pituitary decreases, and that's one of the causes of muscle atrophy as we age. The thyroid gland usually decreases its output of thyroid hormones as we age, and that causes a decrease in the basal metabolic rate, which increases body fat and hypothyroidism, which is seen most often in older people. Because there's less negative feedback, lower level of thyroid hormones, the level of thyroid stimulating hormone increases as we age. With aging also, the parathyroid hormone levels raise due to inadequate intake of calcium. In a study of older women who took calcium supplements, blood levels of parathyroid were as low as those of younger women. Both calcitriol and calcitonin levels are lower in the elderly. Together, the rise in parathyroid hormone and the fall in calcitonin levels is going to increase the risk of age-related decrease in bone mass, and of course that leads to osteoporosis and an increased risk of fractures because of those brittle bones. The adrenal glands contain increasingly more and more fibrous tissue and produce less cortisol and less aldosterone as we age. However, the production of epi and norepi remains normal. The pancreas releases insulin more slowly. The receptor sensitivity to glucose declines, and as a result of both of those, blood glucose levels in older people increases faster and returns back to normal more slowly than younger individuals. The thymus we talked about with the immune system, it's largest during infancy, and after puberty its size begins to decrease, and a lot of the tissue is going to be replaced by adipose and areolar connective tissue. In older adults, the thymus has atrophied almost completely. However, it does still produce a few new T cells for immune responses. The ovaries decrease in size and they no longer respond to the gonadotropins. This results in decreased output of estrogen and leads to conditions such as osteoporosis, high cholesterol, and atherosclerosis. FSH and LH levels are high because there's less negative feedback because the estrogen levels have decreased. Testosterone production by the testes decreases, but the effects are usually not apparent until very old age. And many elderly males can still produce active sperm cells in normal numbers, even though there are higher numbers of abnormal sperm, and those sperm also typically have decreased motility. So, like with everything else, when we get old, things start falling apart. All right, so just a quick look at a couple of more homeostatic imbalances and disorders here as we wrap up the endocrine system. Gynecomastia is where you have excessive development of mammary glands in a male. One of the most common causes of this is an adrenal gland tumor that can cause too much estrogen to be made from the adrenal glands. So the androgens that are normally made can be converted to estrogen, and sometimes the tumors will cause that to occur. Hirsutism is the presence of excessive body and facial hair in a male pattern, but especially noticeable in women. So when women tend to develop that facial hair, and this can be due to excessive androgen production due to adrenal tumors or to certain drugs. A thyroid storm or a thyroid crisis is a severe state of hyperthyroidism that can be life-threatening. So it's characterized by extremely high body temperatures, extremely high heart rate, high blood pressure, abdominal pain, vomiting, diarrhea, agitation, tremors, confusion, seizure, and possible coma. What else do we have here? Oh, virilizing adenoma, a tumor of the adrenal glands that causes excesses androgen, which causes masculinization or virilism in females. Occasionally, adrenal tumors will liberate a lot of estrogens to the extent that a male patient develops gynecomastia, as we saw in the first little bullet on this slide. And in that case, the tumor is called a feminizing adenoma. And then finally, our focus on homeostasis, where I ask you just to read over all of this. As we've seen with everything we've talked about, none of our body systems functions by itself. The endocrine system and all of the body systems work together to maintain homeostasis in the body. So take a moment and read over this just so that you do have the ability to make those connections between systems and appreciate how your body functions and how it works together to keep you doing what you do.